So welcome to part 2 of chapter 6 A&P. This part's going to primarily cover the cardiovascular system as well as a few other elements. So the basic part of the cardiovascular system is the heart, the big pumping mechanism, the blood that is pumped through and circulated throughout the body, and those blood vessels that comprise within the blood. The heart is comprised of 4 chambers, the 2 atria, which are the top chambers of the heart, and the 2 ventricles, the lower chambers. So as the blood flows throughout the heart, it returns from the rest of the body into the right atrium. From the right atrium, it goes down into the right ventricle. From the right ventricle, it pumps blood into the lungs. From the lungs, it comes back into the left atrium, and then from the left atrium to the left ventricle, and then throughout the rest of the body. So as you see, to reiterate, blood returns through the vena cava, goes into the heart, through the right atrium, through the tricuspid valve to the right ventricle, through the pulmonary arteries, back from the lungs into the pulmonary veins, left atrium, through the bicuspid valve, left ventricle, throughout the rest of the body. Now you see here how thick the muscular wall is at left ventricle. Bigger muscle than the right side. So that left ventricle is the powerhouse of the heart. That's what squeezes all the blood and does the most of the work. So that left ventricle is responsible for circulating the blood everywhere. The right ventricle just pushes it to the lungs. Left side has to push it through the rest of the heart. So you need to know these valves in the heart too. So if you think about order that it goes through the tricuspid valve before the bicuspid valve. So as the infamous saying goes, you need to try it before you buy it. And the conduction system of the heart. The heart runs on electrical activity. So when you see on the movies and stuff, those little waves, the beep, beep on the monitor, that monitor is analyzing the electrical waves within that heart. So as the heart goes up here, the sinoatrial node, or the SA node, is the pacemaker of the heart. This is where all electrical current should be happening from the heart. So basically, sends an electrical current here, makes the top part of the heart squeeze, signal goes on down, makes the bottom part of the heart squeeze. If the heart goes into crazy rhythms, if this fails, these other nodes, as you see here, the atrioventricular node, the AV node, is kind of the backup to the SA node. It then goes on down here to the bundle branches and throughout. As we get a little bit further into it, you'll learn a little bit more about these, but just know that the heart has some backup nodes. So if it starts firing down here, is when the heart's really sick and it's running on its battery backup, essentially. Next, you'll watch an animated video on blood circulation throughout the body. This animation will show the circulation of the heart. As you see in the video, the heart's squeezing. As the top part, the atrial part, contracts, pushes blood down the ventricles, both ventricles squeeze at the same time. So the top part of the heart squeezes, then it goes on for the bottom heart to squeeze. So blood returns to the heart via the vena cava, the superior and inferior vena cava. Then that blood flows into the right atrium. To the right atrium, the blood flows down in the right ventricle, and the ventricle squeezes it through the pulmonary arteries going into the left and then into the right lungs. So as the blood flows into the lungs, it goes through the oxygenation process, and then oxygenated blood returns through the pulmonary vein in the left atrium and then into the left ventricle. Then from the left ventricle is squeezed out through the aorta. Through the aorta, the blood circulates throughout the rest of the whole entire body. So with the circulation of the blood throughout the heart and throughout the body, there's some important arteries you need to know. The coronary arteries are the arteries of the heart. The heart has its own circulatory system, so as blood is pumped out through the aorta, there's a little bit of blood that comes out of that into the coronary arteries and just circulates within the heart. So there's nothing that actually leaves the heart that pumps right back into the heart to circulate it. It's its own little circulatory system, that the vessels that are wrapped around the heart. And then the aorta The aorta is the biggest vessel in the body. Aorta, the biggest vessel in the body. So that's right where the blood leaves the heart, is at aorta. The aorta is responsible for carrying the blood throughout the systemic system. The pulmonary artery is where the blood leaves the heart on the way to the lungs. So arteries carry blood away from the heart. Veins carry blood to the heart. So a little unique thing is generally arteries carry the oxygenated blood, since after the bloods went through the lungs and come back into the heart, that is generally carrying oxygenated blood, like going through the aorta. It's already done its circulation, gas exchange, fully loaded with oxygen on its way out to the rest of the body, except the pulmonary artery. The pulmonary artery, since it hasn't made it to the lungs yet, has the deoxygenated blood. The carotid artery, everybody's probably familiar with the carotid artery in your neck. So when you're checking for a pulse in an unresponsive person, this is where you check it. So those arteries is where we're checking pulses. So carotid arteries up in the neck, a couple fingers wide of that cricoid cartilage. Femoral artery is right in the hip, right in the groin region. It's one that's often difficult to feel, and sometimes people are really uncomfortable you sticking your hand there checking for pulses. But this is the way we go and detect a pulse to ensure good circulation. Some more arteries to know. The brachial artery. The brachial artery is in between the elbow and your armpit. So if you would kind of feel on the medial side of your arm, at about the base of your bicep, you can probably still feel a pulse there. The radial artery, thinking about where your radius bone is, remember on that thumb side. So that radial artery, you check just right about below your thumb joint. This is where you're going to be able to feel that radial pulse. The posterior tibial artery and the dorsalis pedis artery are pulses you'll feel on the feet. So posterior, thinking about the medical terminology, thinking about on the back side of the tibia is where you'll feel the artery. So if you kind of feel behind your ankle bone on the inside, on the medial side, you'll be able to feel a pulse there. And the dorsalis pedis, thinking about dorsalis on the back side of, so basically if you feel on the top of your foot, on the arch of it, thinking about animals and their dorsal fins, thinking about if your foot had a fin, where it would be is where you're going to feel the dorsalis pedis pulse. As that blood circulates through those arteries, eventually those arteries get a little bit smaller. So as the arteries branch out, it's kind of like tree roots. They're really big. As they go out, they branch out, and get smaller and smaller and smaller. So as the arteries start getting smaller, they'll eventually get down to the smaller arteries called the arterioles. Then those arterioles will break down even smaller and go to the capillary bed. So basically at the capillary bed is where everything goes from blood being in an artery to going backside to being a vein. So at the artery goes in the arterioles. At the capillary bed, that's where all the nutritional stuff gets exchanged, oxygen gets into the cells, and then carbon dioxide is offloaded coming back in through the veins. So at those veins, they start out as venules, and then they go on up into veins. And in every part of a vein, there is a valve. Basically, this valve just prevents, if there's cardiac compromise, to prevent blood from going the wrong way throughout the system. So just knowing that the artery gets a little bit smaller, goes arterioles to the capillary bed, and those capillary beds are at the furthest point away. So, thinking about your fingertips, the tips of your toes, really small areas, that's where the capillary beds are, where all the stuff happens at the cellular level. And then at the venules, going back up as it gets bigger, and then it goes to the veins, and then the veins return all the way into the heart, and it all starts over. With the composition of the blood, the plasma makes up more than half of the volume of blood. Then within all that is the red blood cells, erythrocytes, and red corpuscles. The white blood cells, leukocytes, and white corpuscles Of course, white blood cells having to deal with immune systems and all of that, and the red blood cells, they're the important thing. That's where your hemoglobin and everything is, where it's carrying the oxygen and everything on those red blood cells. And the platelets is what helps with the clotting process. So when you feel a pulse at those arteries we're talking about, basically what you're feeling is a pressure that's being exerted against that artery caused by the heart squeezing. So as the heart squeezes, it pushes blood out. So in that vessel, it's feeling basically that wave of blood coming. That's what makes it stretch out. So every time you feel that pulse is when that ventricle squeezes. So if you were to put your finger on your radial artery and then listen to your heart with the stethoscope, every time you'd hear that heart go thump, you would feel your pulse. So basically what you want to do when you're feeling for that artery is generally over a bony area so you can get that good pressure coming back. So again, those peripheral pulses you're looking for, the radial at your wrist on your radius bone, the brachial in between your elbow and your armpit, the posterior tibial, that's behind your ankle bone, and dorsalis pedis on top of your foot. Like I said, if your foot had a dorsal fin, that's where you would feel that dorsalis pedis. And the central pulses, that carotid up by your neck, and the femoral in your groin. A good note to know, that carotid pulse is the weakest pulse you'll be able to feel. So if that patient's blood pressure is dropping from distances out in, the last pulse you'll be able to feel in the body is that carotid pulse. So that's why on unresponsive patients, that's the very first pulse we feel is a carotid. Because if you don't feel one there, their heart's not beating. Just as when you're feeling that pulse, you're feeling that exertion of pressure against a vessel, that's how you measure the blood pressure. So systolic pressure in that vessel is that force of pressure that's being exerted out. So if you think about, there's always blood in that vessel, so whenever the biggest surge comes through of that pressure coming in, that's your systolic pressure. That is the arterial pressure when that left ventricle is squeezing, sending that surge of blood throughout the body. The diastolic is that pressure that's still in there. As there's a little bit of residual pressure, that vessel staying open is that diastolic pressure. So that diastolic pressure is a pressure exerted against the vessel, keeping the vessel open. So it's just kind of like a water balloon. For the water balloon to fill up and take a shape, it has to be full of water. So that diastolic pressure is just that pressure that's exerted against that water balloon whenever it's just at rest. Now if you would hook a super soaker up to the end of that water balloon, every time you pumped it and squirted more water in there, that's just like your systolic pressure. And with the circulation, essentially circulation of blood and everything is called perfusion. Perfusion just means that there's adequate circulation of blood and a good exchange of oxygen and waste products. So not only is the blood getting to where it's supposed to be, but the oxygen is getting off the red blood cell and that carbon dioxide getting on the red blood cell to exhale it eventually. Then hypoperfusion is shock. So you've probably heard the term of shock. What's a little bit different in here than maybe what you might realize. So all that shock is means that there's not enough blood flow. That they are hypoperfusing, low perfusion. Whether it be that they've been shot or experienced a traumatic injury and a lot of their blood is on the ground, so there's not enough blood in their body anymore to circulate properly, or they've got heart failure, but for whatever reason there's not a good circulation of blood. Because the body relies on a good working relationship between the respiratory system and the cardiopulmonary system. So your heart and your lungs and everything have to work well together, so the heart's got to squeeze that blood around and around, and those lungs have to cooperate to help with the gas exchange. So moving away from the cardiovascular system, we'll talk about the lymphatic system. Basically what the lymphatic system is, is it captures fluid coming off of cells and everything called lymph. What this does is it maintains a balance of fluid throughout the body. If it wasn't for this system, you would just be like a big blob of water because your body wouldn't be able to balance it all out and for you to urinate it out, sweat, everything like that. Also, the lymphatic system is a very vital component of the immune system. The organs of the lymphatic system are the adenoids, the tonsils, the spleen, the thymus, and the nodes. So you've probably heard about your lymph nodes being swollen, or if you go to a doctor you feel like you're sick and they go and check and poke you in the neck and are checking for lymph nodes. They're wanting to see if your lymphatic system is overworking, if it's taking on extra fluid from bacteria and stuff like that, because if they're inflamed and there's more lymph coming off of from bacteria, good sign that you have an infection. Then they're going to write your prescription for an antibiotic. As a note, avoid taking blood pressure on the side of a woman's body where a mastectomy has been performed. A mastectomy meaning that a woman who has had a breast removed due to breast cancer or whatever reason. Because when they've had it happen, they've had their breast taken away, and part of that's the lymphatic system that they've been taken out. So there's just a little bit of lymph tissue left in there, and that big pressure squeeze from that BP cuff can really damage that tissue. So if a patient's had a left-sided mastectomy, don't take a blood pressure in the left arm. The nervous system, comprised of the central nervous system, is the big part. That's your brain and the spinal cord. So your brain up in your skull connects to that spinal cord that runs down through the vertebrae of your spine. So spine are hollow and that spinal cord runs down between them because the vertebrae of the spine are there to protect the spinal cord. It's part of the skeletal system. Its job is to protect the important stuff. With the peripheral nervous system, those are your sensory and motor nerves. So just think in your head how fast it all works. You go and you touch something really hot. The sensory nerves in your hand send a signal back to the brain and says, holy crap, that's hot. Then the brain says, you're right, holy crap, it is hot. Then sends a signal back to the motor nerves to say, move your hand, dummy, that's hot. So just think about how fast it actually works when you touch something hot. Now, also know with that in younger populations and older populations, that signal gets a little bit slowed. So sometimes if you've ever seen a kid, hurt themselves, sometimes it takes a little while for them to start crying, or if they touch something that's hot, it might take a little bit longer for that sensory to work to send the signal back to move the hand. And that autonomic nervous system is those involuntarily motor functions. So that nervous system has to deal with all the involuntary muscles that we've talked about earlier, of like your GI tract, your stomach, all that stuff is all part of the nervous system, and it's all stuff that you can't control, it just happens. So in this illustration here, you see the central nervous system of your brain and the spinal cord running straight down in between the vertebrae. As you see in this picture over here, your vertebrae, the spinous processes, that's the bony part of your back you can feel. So this is the posterior side and the anterior side. And then that's a hollow core that the spinal cord runs down. Over here, see, as it runs down, it branches out. Then a spinal cord runs down just about to behind your belly button to where it all finally ends and it branches out even lower and lower and lower. So if one were to damage a spinal cord, say at the neck, that's just going to affect the sensory and stuff on its way down. So it's just like taking a power cord and cutting it in half. Wherever you cut that, below that, there's not going to be any signal sent, but there can still be power sent up to here. So say if right here, somebody were to break their back and cut their spinal cord, they would be paralyzed, most likely from here down, or lose all their sensory. With the digestive system, mechanism which your food travels through the body. I think everybody pretty much knows what your digestive system is. So that consists of your stomach, the small intestine, and the large intestine. The digestive system has some accessory organs, such as the liver, gallbladder, pancreas, spleen, and appendix. The liver, which produces bile, The bile goes into the small intestine, helps with breakdown of fats, and it does some other things like detoxifying harmful substances in the bloodstream, storing sugars, and assisting with production of blood. So one big thing where people are familiar with is with livers and alcoholics. The liver's filtering out that harmful stuff within the blood. The gallbladder is a storage system for that bile for the liver. The pancreas, most commonly known as producing insulin for the metabolism of sugar within the bloodstream. And the spleen also acts as a blood filtering mechanism, and it also has a reservoir of blood, pretty much just like as a backup. And the appendix, the appendix is kind of one of those things where they're not real sure what it does, just knows that it aids a little bit in the digestive system, and commonly known for lower abdominal pains, appendicitis, and various things like that. But some of those are things that can be taken out, and everybody still lives okay without them. With the integumentary system, basically that's your skin. So it's got functions of protection. It's kind of like our skin's pretty much just like the covering of a banana. You peel it away, the banana rots. So that peeled banana, just like our skin, keeps us all nice and protected. Helps maintain water balance with sweating and whatnot. The temperature regulation, so if we're too hot, we'll start sweating to help cool ourselves down. If we get cold, we get these goosebumps, makes our skin pop up to try to absorb more heat. Excretion, just like with sweating and whatnot. And impact absorption, just another mechanism for protection. There's 3 layers of the skin: the epidermis, dermis, and the subcutaneous. So the epidermis is that top part. Basically, the epidermis is a part that commonly gets burnt or will be commonly tan. And the very end of that part of it is a little bit of sensory organs, but mostly the sensory organs tied into the dermis layer. So dermis layer is where pretty much all the blood and everything is circulated in. And the subcutaneous layer is where the nerves and the major arteries are at, and the veins, and all the fattiness, and a little bit of more nerve roots and big hair roots. The endocrine system is for the purpose of hormone production. So those hormones, not just, the hormonal female or hormonal male, it's not that, but those hormones produced to regulate many body activities and function. Just like the pancreas, part of hormonal system. Pancreas producing insulin that helps with metabolism of sugar. The adrenal glands secreting epinephrine, so that epinephrine helps with the nervous system as well too, as many other things. So it's all kind of a fine balancing act. So you see here some different glands of the endocrine system. The thymus gland assists with the development of the immune system. Adrenal glands help regulate water and produce epinephrine. The pancreas producing insulin to control blood sugar levels, and various other aspects in those. With the renal system, this comprises of your kidneys and the urinary system, helps regulate the fluid levels within the body, filter out more chemicals, and adjust the body's pH. So if any of you have a pool and you throw in those tablets, you're always measuring the pH to make sure everything in the water is just nice. That's pretty much a job of the renal system. So peeing everything out, filtering everything out, that's where everything kind of ties into place. So the kidneys, the biggest organs of that, filtering everything out, and the bladder is that fluid reserve. So the kidneys filter everything out, dump the excess back into your bladder, and then you pee it out. So illustrations of the renal system: your kidneys will kind of located up on your posterior side, about mid-back, and then it all ties into your ureters. So as you see here, kidneys and ureters come down, and they'll connect into your bladder. So a lot of times as people have kidney pains, they start here and kind of go down in through the groin and into the bladder, right in the pubic region. So last, the ureters, they're transporting that urine from the kidneys down to the bladder, and the urethra is the passageway from that bladder to the outside.